Have you ever heard of an orgasm where no semen is visibly released? It might sound unusual, even mysterious, but for some men, this phenomenon is a reality. This condition, called retrograde ejaculation, occurs when semen flows backward into the bladder instead of exiting through the penis during orgasm. Imagine achieving climax but without the expected physical release, a dry orgasm that can leave many questions unanswered. For men trying to conceive, retrograde ejaculation can be particularly distressing, as it prevents sperm from reaching the egg, significantly lowering the chances of natural conception. Beyond fertility, the condition can also create a sense of embarrassment or frustration, especially when men are unaware of its causes or solutions. In this video, we aim to demystify retrograde ejaculation. Together, we'll explore the 6 most common causes of this condition and discuss practical steps you can take to manage or treat it. If you've ever wondered about this unusual sexual health issue or want to understand the complexities of male reproductive health better, stay tuned. The insights might surprise you, and the solutions could offer hope and clarity. If you haven't joined our community yet, I invite you to hit the subscribe button and turn on the notification bell so you're always up to date with our latest content. I'd love to hear your thoughts on today's discussion. If you find this content helpful, drop a 1 in the comments below. If it doesn't quite resonate with you, leave a 0. Your feedback is invaluable. It helps me craft videos that better suit your interests and needs. Now, let's dive right in. To truly grasp retrograde ejaculation, let's take a closer look at the biological mechanics behind this condition. Retrograde ejaculation occurs when a crucial muscle in the body, known as the bladder neck muscle, fails to perform its essential role during orgasm. Under normal circumstances, this muscle tightens at the exact moment of ejaculation, effectively creating a one-way pathway for semen to exit through the penis. However, when this muscle fails to tighten, semen diverts from its intended route, traveling backward into the bladder instead. This backward flow results in what many refer to as a dry orgasm. The term aptly describes the experience of orgasm without the typical visible release of semen. For men unfamiliar with the condition, it can be perplexing and even alarming the first time it happens. However, it's important to note that retrograde ejaculation doesn't generally interfere with the sensation of orgasm itself. In other words, men experiencing this condition still enjoy the physical and emotional climax, but may find themselves questioning why there's little to no ejaculation. The implications of retrograde ejaculation extend beyond the unusual mechanics of a dry orgasm. One of the most significant concerns is its impact on fertility. Because the sperm doesn't exit the body in the usual manner, it cannot reach the egg for fertilization. For couples trying to conceive, this can be an unexpected and challenging barrier. Fertility issues often bring an emotional toll, and the mystery surrounding retrograde ejaculation can make it even more stressful for those unaware of its causes or treatments. Another hallmark sign of retrograde ejaculation is cloudy urine post-orgasm. This occurs because the semen that flows backward into the bladder doesn't remain there indefinitely. It exits the body during urination, mixing with urine. For some, this visual cue can be the first indication that something unusual is happening. While the condition itself is not typically harmful to overall health, it's a signal that the reproductive system isn't functioning as it should, warranting attention from a medical professional. Retrograde ejaculation doesn't arise from a single cause, but can result from various underlying factors, from nerve damage and chronic illnesses to surgical complications and medication side effects. The reasons behind this condition are as diverse as the men who experience it. Understanding the potential triggers is key to addressing the issue effectively and finding the right path to treatment. Now that we've explored the mechanics of retrograde ejaculation and its impact, let's delve into the first major cause: nerve damage. This hidden factor plays a significant role in many cases of retrograde ejaculation and sheds light on the intricate connection between our nervous and reproductive systems. The human body is a marvel of interconnected systems, and nowhere is this more evident than in the relationship between our nerves and sexual health. Retrograde ejaculation often has its roots in nerve damage, which disrupts the precise communication necessary for the bladder and neck muscle to perform their role during ejaculation. When this intricate system fails, it can result in semen flowing backward into the bladder instead of exiting through the penis. Nerves play a critical role in controlling the bladder-neck muscle and the prostate, two essential components of the male reproductive system. These nerves send and receive signals that coordinate the contraction and relaxation of muscles, ensuring that ejaculation occurs as intended. Damage to these nerves, however, interrupts this delicate balance and can lead to retrograde ejaculation. One of the most common culprits behind nerve damage is diabetes. Prolonged high blood sugar levels, a hallmark of poorly managed diabetes, can damage nerves throughout the body, including those responsible for ejaculation. This condition, known as diabetic neuropathy, affects the peripheral nerves and can impair the signals needed for the bladder and neck muscles to contract during orgasm. For men with diabetes, retrograde ejaculation may be one of the early warning signs of this broader issue. Another significant cause of nerve damage is multiple sclerosis, MS. MS is a chronic neurological condition in which the immune system mistakenly attacks the protective covering of nerve fibers, disrupting the flow of electrical impulses between the brain and the rest of the body. This disruption can extend to the nerves involved in ejaculation, preventing the bladder and neck muscles from functioning properly. Retrograde ejaculation, in this context, is just one of many challenges men with MS may face in their sexual health. Spinal cord injuries also rank high among the causes of nerve-related retrograde ejaculation. The spinal cord serves as a critical highway for nerve signals, and any trauma to this area can have far-reaching effects on bodily functions. Injuries to the lower back, where the nerves controlling the bladder and reproductive organs are located, are particularly likely to result in ejaculation issues. Whether from an accident, surgery, or another form of trauma, spinal cord injuries can permanently disrupt the coordination required for normal ejaculation. The impact of nerve damage on ejaculation is not merely physical. It can also take an emotional toll. For many men, retrograde ejaculation caused by nerve damage can lead to feelings of frustration, embarrassment, or inadequacy, particularly if fertility is a concern. Without a clear understanding of the underlying cause, these emotions can compound the challenges men face, making it even more critical to seek proper medical evaluation and support. The good news is that nerve damage doesn't always mean permanent loss of function. In some cases, treating the underlying condition, whether it's managing diabetes, addressing MS symptoms, or rehabilitating after a spinal cord injury, can improve symptoms of retrograde ejaculation. Additionally, medical therapies and interventions designed to support nerve health may offer relief, helping men regain confidence in their sexual health. While nerve damage is a significant factor, it's not the only one. Chronic illnesses can also play a major role in retrograde ejaculation, intertwining with nerve health and other bodily systems to create additional challenges. Let's take a closer look at how conditions like diabetes and multiple sclerosis impact not just nerves, but the entire reproductive process. Chronic diseases often leave a lasting mark on the body, affecting not only overall health, but also the intricate systems responsible for sexual and reproductive function. Retrograde ejaculation is one such consequence, particularly when conditions like diabetes and multiple sclerosis (MS) are involved. These illnesses do more than harm the nerves, they disrupt the balance of muscle control and organ function required for ejaculation to occur properly. Diabetes stands out as one of the most common chronic conditions associated with retrograde ejaculation. When blood sugar levels remain elevated over long periods, as is typical in poorly managed diabetes, the resulting damage can extend beyond nerves to include muscles and blood vessels. High blood sugar levels impair the small blood vessels that supply oxygen and nutrients to tissues, leading to the weakening of the bladder and neck muscles. This muscle, essential for directing semen out of the body, becomes incapable of closing tightly during ejaculation. The result, semen flows backward into the bladder, rather than forward through the penis. Men with diabetes often face a double challenge when it comes to retrograde ejaculation. In addition to weakened muscles, diabetic neuropathy, the nerve damage caused by prolonged high blood sugar, further disrupts the coordination required for ejaculation. This dual impact underscores the importance of managing diabetes proactively to minimize complications, including those related to sexual health. Multiple sclerosis (MS) offers another example of how chronic illnesses can interfere with ejaculation. MS is a disease in which the immune system mistakenly attacks the protective covering of nerves called myelin. This damage slows or blocks nerve signals, disrupting communication between the brain and the rest of the body. In men, this disruption can extend to the nerves and muscles involved in ejaculation, leading to conditions like retrograde ejaculation. What makes MS particularly challenging is its unpredictability. The disease affects individuals differently, and its symptoms can vary widely, even within the same person over time. For some men, MS may primarily cause fatigue or muscle weakness, while for others, it disrupts sexual function, including ejaculation. Regardless of its specific manifestations, MS often creates a sense of uncertainty, making early intervention and symptom management essential for maintaining quality of life. Both diabetes and MS highlight the interconnected nature of chronic diseases and sexual health. These conditions don't exist in isolation. They affect the entire body, creating a ripple effect that touches multiple systems. For men with retrograde ejaculation linked to chronic illness, addressing the root cause is vital. This means not only managing the chronic disease itself, but also working with healthcare providers to explore targeted treatments for ejaculation issues. In some cases, treating the underlying chronic condition can significantly improve symptoms of retrograde ejaculation. For example, controlling blood sugar levels in diabetes can slow the progression of nerve and muscle damage, potentially restoring some degree of normal function. Similarly, therapies designed to manage MS symptoms may help reduce the impact on reproductive health. However, it's not just the physical effects of these chronic diseases that matter. The emotional toll can be equally significant. Men with retrograde ejaculation often experience feelings of frustration, embarrassment, or even isolation, particularly if their condition affects their fertility. For couples trying to conceive, the added pressure can strain relationships, making open communication and mutual support critical. While chronic diseases like diabetes and MS are major contributors to retrograde ejaculation, they are far from the only culprits. In some cases, the cause lies not in the body's natural processes, but in the aftermath of medical interventions. Next, we'll explore how surgical complications can lead to this condition, shedding light on the risks and recovery strategies associated with pelvic and spinal procedures. If you are still watching this video and find these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Modern surgical techniques have transformed medical care, offering life-saving treatments and improved quality of life for millions. However, even the most advanced procedures come with potential risks, and one of these is retrograde ejaculation. Surgeries targeting the pelvic region, prostate, bladder, or spinal column can sometimes disrupt the delicate systems that regulate ejaculation, leading to this condition. Prostate surgeries, particularly those performed to treat prostate cancer or benign prostatic hyperplasia, BPH, are among the most common causes of retrograde ejaculation. The prostate gland plays a pivotal role in ejaculation, contributing fluid to semen and assisting in its propulsion. During procedures like a prostatectomy, removal of the prostate, surgeons may inadvertently affect the nerves or muscles surrounding the bladder neck. While the goal of these surgeries is to preserve life and alleviate serious conditions, the collateral impact on sexual function is a known risk. Similarly, bladder surgeries often target areas near the bladder neck, the same region responsible for directing semen flow during ejaculation. Operations to remove tumors, repair injuries, or treat severe bladder conditions can compromise the integrity of the bladder neck muscle or its controlling nerves. When this happens, the muscle may no longer close properly during ejaculation, allowing semen to flow backward into the bladder. Colorectal surgeries, particularly those involving the lower bowel or rectum, are another potential cause. These procedures are often necessary for treating conditions like colorectal cancer, inflammatory bowel disease, or severe hemorrhoids. However, the proximity of the rectum to the nerves governing pelvic functions increases the likelihood of unintentional damage during surgery. Finally, spinal surgeries aimed at addressing issues like herniated discs or spinal cord compression can also lead to retrograde ejaculation. The spinal cord serves as the primary highway for nerve signals traveling between the brain and the body. Disruptions to this pathway, whether from surgical intervention, trauma, or disease, can interfere with the complex coordination required for ejaculation. These surgical complications underscore the intricate relationship between anatomy and sexual function. The pelvic region is home to a dense network of nerves, muscles, and blood vessels that work in harmony to support reproductive health. Even minor disruptions to this system can have significant effects, making retrograde ejaculation a potential outcome of many pelvic and spinal surgeries. The emotional impact of retrograde ejaculation after surgery is often profound. Men who undergo these procedures may already be grappling with the stress of a serious medical condition. Adding a complication like retrograde ejaculation, particularly if it wasn't fully anticipated, can lead to feelings of frustration, disappointment, or loss. For men who desire to have children, the impact on fertility can be especially disheartening. Fortunately, advances in surgical techniques aim to minimize these risks. For example, nerve-sparing procedures have become more common in prostate and bladder surgeries, reducing the likelihood of retrograde ejaculation. Additionally, healthcare providers are increasingly proactive about discussing potential side effects with patients before surgery, helping them make informed decisions and prepare for post-operative outcomes. If retrograde ejaculation does occur after surgery, various treatment options may be available. In some cases, medications can help strengthen the bladder neck muscle or stimulate ejaculation. For men facing fertility challenges, assisted reproductive techniques, such as sperm retrieval, can offer a path forward. Open communication with healthcare providers is essential to explore these solutions and address both the physical and emotional aspects of recovery. While surgical complications highlight the risks of medical interventions, they're not the only external factor at play. Certain medications, often prescribed to manage other health conditions, can also interfere with ejaculation. Let's explore how these drugs can contribute to retrograde ejaculation and what you can do if you suspect your medication is the cause. Medications are an essential tool for managing countless health conditions, improving lives, and alleviating symptoms. However, as effective as they may be, some drugs come with unintended side effects, including their potential to disrupt the body's delicate systems responsible for ejaculation. Retrograde ejaculation is one such side effect, often linked to medications that affect the bladder and neck muscle or alter nerve signals. A common category of drugs associated with retrograde ejaculation is antidepressants. Specifically, selective serotonin reuptake inhibitors, SSRIs, and tricyclic antidepressants, widely prescribed to treat depression and anxiety, can interfere with ejaculation. These medications work by altering the balance of neurotransmitters in the brain, which can impact the nervous system's control over the bladder and neck muscles. For some men, this leads to a failure of the muscle to contract during orgasm, allowing semen to flow backward into the bladder instead of exiting through the penis. Medications for high blood pressure, such as alpha blockers, are another frequent contributor. While these drugs are highly effective in relaxing blood vessels and lowering blood pressure, they can also relax the bladder and neck muscles. This unintended relaxation prevents the muscle from closing tightly during ejaculation, resulting in retrograde ejaculation. Men taking alpha blockers for conditions like hypertension or prostate issues may notice changes in their sexual function, including a reduction or absence of visible semen during climax. Drugs used to treat benign prostatic hyperplasia, BPH, a condition characterized by an enlarged prostate, are also a significant cause of retrograde ejaculation. Medications like tamsulosin, an alpha blocker commonly prescribed for BPH, are designed to relax the muscles in the prostate and bladder neck, easing urinary symptoms. However, this same mechanism of action can impair the bladder neck muscle's ability to close during ejaculation, causing semen to flow into the bladder instead. Men taking these medications often face a dilemma. While the drugs effectively manage their primary condition, The side effect of retrograde ejaculation can feel like an unwelcome trade-off, especially if fertility or sexual satisfaction is a concern. For men planning to conceive, the lack of visible semen can be alarming and may prompt questions about their reproductive health. The good news is that retrograde ejaculation caused by medications is often reversible. If you suspect your medication is contributing to this condition, the first step is to consult your doctor. Avoid discontinuing the drug on your own, as this could lead to complications or a return of the symptoms the medication was addressing. Instead, your doctor may suggest adjusting the dosage, switching to an alternative medication, or exploring additional treatments to mitigate the side effects. For example, if an alpha blocker is the cause, your doctor might recommend a different class of medication to manage your condition without compromising sexual function. In some cases, adding a medication specifically designed to enhance bladder neck muscle tone can counteract the effects of the original drug. This tailored approach ensures that your overall health remains a priority while addressing the challenges posed by retrograde ejaculation. It's also important to have an open and honest dialogue with your healthcare provider about how medications are affecting your sexual health. Many men feel hesitant to discuss issues like retrograde ejaculation, fearing embarrassment or dismissal. However, doctors are well equipped to address these concerns and provide solutions that align with your health goals and personal needs. Remember, your comfort and well-being are central to effective treatment, and retrograde ejaculation is a manageable condition when approached with the right guidance. While medications are a controllable cause of retrograde ejaculation, some factors lie outside the realm of treatment choices. Congenital abnormalities, present from birth, can also interfere with the body's natural mechanisms for ejaculation. Let's examine how these structural conditions contribute to retrograde ejaculation and what options are available for men born with these challenges. Not all cases of retrograde ejaculation develop over time. For some men, the condition is tied to congenital abnormalities and structural issues in the bladder or reproductive system that are present from birth. These inherent differences in anatomy can predispose individuals to challenges with ejaculation, often requiring medical intervention to address the underlying cause. One of the most common congenital factors contributing to retrograde ejaculation is malformed bladder neck muscles. In a typical male reproductive system, these muscles are designed to tighten during ejaculation, preventing semen from flowing backward into the bladder. However, if these muscles are underdeveloped or improperly formed, they may fail to perform this critical function. The result is a disrupted pathway for semen, causing it to enter the bladder instead of exiting through the penis. Urethral abnormalities are another congenital issue linked to retrograde ejaculation. The urethra, which serves as the conduit for both urine and semen, must maintain precise coordination with the bladder neck muscle during ejaculation. Structural irregularities, such as a misaligned or narrowed urethra, can interfere with this process, diverting semen into the bladder. These abnormalities are often subtle and may go undiagnosed until a man experiences difficulties with fertility or notices unusual changes in his sexual health. Men with congenital abnormalities leading to retrograde ejaculation may experience the condition as a lifelong issue, often without realizing its cause. For many, the first indication arises when attempting to conceive, as the absence of visible semen becomes a significant concern. Additionally, these structural conditions can sometimes coexist with other urinary or reproductive health challenges, further complicating diagnosis and treatment. Medical evaluation is essential for identifying congenital causes of retrograde ejaculation. Doctors typically use a combination of medical history, physical examination, and diagnostic tests to pinpoint the issue. In cases involving malformed bladder neck muscles or urethral abnormalities, imaging techniques such as ultrasound or MRI may be employed to visualize the structures involved and assess their functionality. Treatment options for congenital abnormalities vary depending on the severity of the condition. For some men, lifestyle adjustments and medical therapies may suffice to manage symptoms and improve ejaculation function. For others, particularly those with significant structural issues, surgical intervention may be necessary. Procedures aimed at correcting the alignment or functionality of the bladder neck muscles or urethra can help restore a more natural ejaculation process, often improving both fertility and sexual satisfaction. It's important to note that addressing congenital abnormalities is about more than just physical repair. It's also about addressing the emotional and psychological impacts of living with a lifelong condition. Men who discover their retrograde ejaculation stems from a congenital cause may feel a mix of relief at having an explanation and frustration over the challenges they've faced. Open communication with healthcare providers, along with access to counseling or support groups, can help navigate these feelings and create a positive path forward. Congenital abnormalities serve as a reminder of the incredible complexity of the male reproductive system and the many factors that can influence its function. While these conditions may present unique challenges, advances in medical science offer hope and solutions for men seeking to overcome them. While congenital abnormalities highlight the role of structural issues in retrograde ejaculation, emotional and psychological factors also play a significant part. Next, we'll delve into how stress, anxiety, and certain habits can disrupt ejaculation, shedding light on the intricate connection between the mind and body. When it comes to retrograde ejaculation, the connection between the mind and body cannot be underestimated. Psychological factors and learned behaviors can significantly disrupt the delicate coordination required for ejaculation, making stress, anxiety, and certain sexual habits silent contributors to this condition. These issues, though often less discussed than physical causes, are equally impactful and deserving of attention. Bookmark. Stress and anxiety are among the leading psychological factors affecting ejaculation. For men, performance anxiety can become a mental barrier, disrupting the intricate timing and coordination between the brain, nerves, and muscles involved in ejaculation. This heightened state of tension can prevent the bladder neck muscle from contracting properly, creating conditions for semen to flow backward into the bladder. The pressure to perform, fear of inadequacy, or past sexual experiences can amplify these feelings, turning a moment of intimacy into a source of stress rather than pleasure. Additionally, habitual suppression of ejaculation, whether intentional or unintentional, can alter the normal functioning of the reproductive system over time. For example, repeatedly delaying or holding back ejaculation during sexual activity may interfere with the natural coordination of muscle contractions. While such practices may initially seem harmless, they can condition the body to respond in ways that disrupt ejaculation, including increasing the risk of retrograde ejaculation. The effects of psychological factors often extend beyond the physical symptoms of retrograde ejaculation. Men may experience frustration, embarrassment, or a diminished sense of self-esteem, particularly if the condition persists without explanation. These emotional responses can create a cycle of stress and anxiety, further exacerbating the problem and making it more challenging to overcome. The good news is that psychological causes of retrograde ejaculation are often highly treatable with the right approach. Counseling or therapy can be instrumental in addressing the underlying stressors or anxieties contributing to the condition. Cognitive behavioral therapy, CBT, for instance, is an evidence-based approach that helps men identify and change negative thought patterns, improving both mental well-being and sexual function. Adopting healthier habits is another key strategy for mitigating the psychological factors behind retrograde ejaculation. Mindfulness practices such as meditation or deep breathing exercises can help men manage stress and build resilience against performance anxiety. Open communication with a partner about fears or insecurities can also foster a supportive environment, alleviating some of the pressure that contributes to the condition. For men whose habits have led to learned behaviors that disrupt ejaculation, unlearning these patterns requires patience and guidance. A sex therapist or urologist specializing in male reproductive health can provide personalized strategies to retrain the body and restore a more natural ejaculation process. This may involve gradual exposure techniques, exercises to strengthen pelvic floor muscles, or other tailored interventions. It's important to approach psychological factors with compassion and understanding. Retrograde ejaculation tied to stress or habits is not a failure, but a signal that the body and mind are out of sync. By addressing these factors directly and holistically, men can reclaim confidence in their sexual health and break the cycle of anxiety that often accompanies this condition. Retrograde ejaculation may seem complex, but it's a manageable condition with the right understanding and support. Whether caused by physical, psychological, or lifestyle factors, addressing it starts with open communication and seeking professional guidance. Remember, you're not alone. Solutions are available, and taking the first step can lead to improved confidence, health, and well-being. If you found this video helpful, don't forget to give it a thumbs up and share it with someone who might benefit from this topic. Have any thoughts or personal experiences to share? Drop them in the comments below. I'd love to hear from you. And if you haven't already, click the subscribe button and ring the notification bell to join our community for more empowering content. Thank you for watching, and until next time, embrace the journey with confidence.